in pharmacology. Today we discuss another case. A 66-year-old man came to your clinic for evaluation of a tremor. On examination, he took several small shuffling steps before he could reach his full stride. And patient was diagnosed as having Parkinson's disease and was prescribed combination of levodopa and carbidopa. So here it is a case of Parkinson's disease and prescription is of levodopa carbidopa combination, and the questions are: what are the advantages of levodopa carbidopa combination in the treatment of Parkinsonism, and list other pharmacological agents which can be used for treatment of this condition, and what are the side effects of levodopa carbidopa combination therapy. Now before going further, there can be other questions also asked in such type of a case. So you can just note it down. One is the what is the pharmacological basis of using levodopa in this condition? Then why dopamine is not used in this condition even though it is available? And third is why we are using the levodopa carbidopa combination. Why not levodopa alone? Then, what are the advantages of this combination? This has been already asked. But what are the limitations of this combination? These can also be asked. Okay, so there are n number of questions that can be asked, but we focus on the given questions. First of all, what are the advantages of levodopa carbidopa combination? So I will prepare one another next presentation on what is the pharmacological basis of levodopa and what is the pharmacological basis of levodopa and carbidopa, because these answers will be helpful to understand this question. Okay, I am just briefing you because it will be helpful to understanding the answer of this. Carbidopa is a peripheral decarboxylase inhibitor, and levodopa, why we are giving levodopa? The reason is that dopamine cannot cross the blood-brain barrier, and if you give the precursor of the dopamine, that is levodopa, it can cross the blood-brain barrier. And once entering inside the brain, the levodopa is converted into dopamine with the help of the decarboxylase enzyme. Now, this decarboxylase enzyme is also present peripherally. So, if you give levodopa alone, in the periphery, levodopa is decarboxylated into the dopamine. So, you have to give significant higher amount of the levodopa so it can enter into the brain. And to avoid this, we are giving levodopa along with carbidopa, because carbidopa is a peripheral decarboxylase inhibitor. It inhibits the peripheral degradation of levodopa, and hence more amount of the levodopa enters into the brain. Okay, this we actually want. So what are the advantages? Obviously there is a prolongation of the half-life of levodopa because the peripheral decarboxylation is inhibited, and that's why as the peripheral decarboxylation is inhibited, so more amount of the levodopa enters into the brain as compared to the levodopa alone, and that's why the dose of the levodopa can be reduced even without reducing its therapeutic effect. And you can also prolong the duration of action also. And over and above, obviously we require certain target level of levodopa, and as the peripheral degradation is not there, that attainment of the target level is very quick. Okay, and because of all these, higher amount of the levodopa reaches the brain, converted into the dopamine, so the degree of the improvement is significantly higher. Okay, and as I have told you, whenever you are giving the levodopa, there is a peripheral degradation of the levodopa into the dopamine, And that dopamine, you all know that dopamine is acting on the various dopaminergic receptors, and these are not only present into the centrally but peripherally also. This dopamine will act on the D2 receptor into the heart, and it will lead to the precipitation of the angina, cardiac stimulation, arrhythmias also. It can lead to the nausea and the vomiting. So all the peripheral side effects of the conversion of levodopa into the dopamine will be there, and this we can definitely minimize at the peripheral degradation will not occur. And yes, what is this ono phenomena? Now, whenever you give levodopa carbidopa combination, okay, what will happen? That there is a significantly higher amount of the levodopa in the brain, so the more amount of the dopamine is available, and because of the sustained level of the dopamine of the levodopa and hence dopamine in the brain, the on-off phenomena is definitely less. Okay. Now, what is this on-off phenomena that we have discussed in another video? And yes, pyridoxal reversal is prevented. Now, what is pyridoxine reversal? Pyridoxine is facilitating the conversion of levodopa into dopamine. Okay, so if you are giving pyridoxine along with the levodopa somehow for some other purpose in the Parkinsonism, what will happen that it facilitates the peripheral conversion of levodopa to dopamine. This will not occur in case of levodopa carbidopa combination because this decarboxylation with the help of the pyridoxine is prevented by carbidopa. So in nutshell, you can prolong the half-life, you can get more therapeutic effect, you can reduce the frequency, you can reduce the dose without affecting the improvement, inhibit or minimize the peripheral adverse effect, minimize the ono phenomena. Okay. Now, which are other agents that can be used in the Parkinsonism? So, in Parkinsonism, you have to remember like this that there is an imbalance between the dopaminergic and the acetylcholine system, and that's why if you can increase the level of the dopamine either by giving dopaminergic agonist or by giving the agents which are responsible for the metabolism of the dopamine, and if you can inhibit that pathway again you can increase the dopamine level in the brain. So either you increases the dopaminergic projection in the brain or you can inhibit the cholinergic activity in the brain. These agents will be helpful in Parkinsonism. In the dopaminergic agonist, bromocriptine, ropinirole and pramipexole. In the COMT, as I told you, see the enzymes that are involved in the metabolism of the dopamine, if you can inhibit, the one is catechol-methyl transferase. If you can inhibit the catechol-methyl transferase inhibitor, tolcapone and entacapone, this can be helpful. MAO-B, there are two types of the MAO, MAO-A and MAO-B. MAO-B is selective for the metabolism of dopamine, monoamine oxidase B, and if you can inhibit this enzyme, this will be helpful in the Parkinsonism. The agents are selegiline and resegiline, NMDA agonist and methyl D aspartate or glutamate agonist, or you can say that dopamine facilitator, that is an antiviral agent, that is amantadine. And as I have told you, these are all the agents which either having a agonistic action on the dopaminergic receptor or they inhibit the enzyme which is involved in the degradation of the dopamine or they facilitate the dopamine. And there is one another group of the agents. These are anticholinergic, not anticholinergic but centrally acting anticholinergic, and these are piperidine and benzaxole. So these are the other agents. This is the second question. And the third question is, which are the adverse effects of levodopa carbidopa? Now here you have to write the adverse effects of the levodopa, and at the end you also have to mention that which adverse effects are increased because of this combination. That should be the ideal answer. So whenever you are giving the levodopa carbidopa combination, there are two types of the adverse effect. One adverse effect is seen at the initiation of the therapy and that gradually diminishes over a period of the time. And the second type of the adverse effect, these are seen after prolonged therapy and they are not going to decrease in the intensity, and there are dose limiting adverse effects. So which adverse effects seen at the initiation of the therapy? Nausea and the vomiting. Obviously, these are less with the levodopa carbidopa combination as compared to the levodopa alone, but still these are there and they decreases over a period of time. Second is the postural hypotension. Then these postural hypotension, again, it is a you can say that whenever you think of the hypotension, you may feel that it is a peripheral adverse effect, but here it is a central adverse effect. Angina and arrhythmias, yes, it is due to the peripheral adverse effects of the dopamine due to the stimulation of the cardiac beta receptor and alteration in the taste sensation. So these adverse effects are seen at the initiation of the therapy, and there are certain adverse effects like dyskinesias. Okay, the abnormal movements. These are seen after the prolonged therapy like tongue thrusting, grimacing, and these adverse effects may limit the administration of the optimum dose of the levodopa also. On-off phenomena, this we will discuss in a totally separate video, and behavioral abnormalities, because here you just remember that the increased dopaminergic level in the brain, it may lead to certain central adverse effects like the anxiety, depression, psychosis, and many more. Okay, so these are the adverse effects which are seen after levodopa or levodopa carbidopa combination. But each adverse effects will be more in case of the levodopa carbidopa combination. Then your answer should be the dyskinesias, behavioral abnormalities, and postural hypotension. They will be aggregated by this combination. Okay, and this is all about the answer of this case, and next time we will discuss about a case of a petit mal epilepsy, and these are the questions. Okay, thank you very much.